Now, in Sierra Leone, the Ebola epidemic had an adverse impact on the health sector. Hundreds of healthcare workers lost their lives after contracting the deadly virus from patients. Hospitals and other health centers that were often ill-equipped to deal with the high numbers of sick people were turned into holding and treatment centers. VOA's Mvunganyi visited a health center located about 25 kilometers from Sierra Leone's capital, Freetown.
At the peak of the Ebola epidemic, Waterloo, a town outside of Freetown, was considered one of the hot spots. The Adventist hospital at Waterloo, popularly known as ADRA, was one of the holding centers. It is said to have recorded over 20 cases per day. Mr. Abbey is the community healthcare officer at the hospital.
This place was both a treatment and a holding center. That is, when patients were sick, or when they were identified in the communities, they were brought here. From here, they were tested. If they show negative, then we'll discharge them back home. But if they were positive, then we'll move them into the other apartment, which was actually the red zone, where the actual Ebola patients were treated.
During the Ebola epidemic, the health center was converted into an emergency health center, taking in patients on a daily basis.
This area was termed the red zone. That is where we kept the actual Ebola patients. So nobody was allowed to go in there if you are not
protected.
Yes.
If you had to have special permission to go in.
Yes, you have to have a special permission to go there, and you go in with a special dressing. You don't just walk in there. So that was the red zone, and this was the green zone. The green zone was actually not much contaminated because the patients were there. So the green zone was an area where the staff were.
As we walk around the hospital grounds, there are still visible signs of the tough times, many left behind by international partners who helped with the fight. So we see a couple of tents here. There's a Japan emergency relief goods tent. There's a UNICEF tent over here. What was this used for?
The bigger one there is the store. That is where, yes.
For the medical supplies?
Medical supply, food supply, whatever was kept in there. This building was the triage.
The triage, okay.
Yes, okay. That is where we received patients.
Because right here, they would come in through the gate?
No, this gate was not used. Okay.
But that's the gate to the main road. You close that off.
It was
and they would come in from behind.
Yes, patients and staff were coming from behind into this triage. The patient we brought in here, one was for females and then the other one was for male.
How many does one hold?
7.
7 patients?
7 patients. The other one 7 patients. So,
what would happen if you have more? If you had more than 7 patients?
We refer to other hospitals.
You refer them to another hospital?
To another hospital.
Okay.
Yeah.
Right by the front gate of the hospital is the area formerly used as a morgue. It is now an open sitting area. During the crisis, the gate was always closed off, open only to burial teams.
Initially, when the area was decontaminated and all the structures gone, when we actually wanted to start our normal activities, our normal work, we called the stakeholders in the community and some other government officials, like the Deputy Minister of Health was here, the District Medical Officer was here.
In a healthcare system that was still struggling to recover from a long civil war, Ebola added another layer of difficulty for the few health workers serving a population of approximately 6.5 million people. Government says that part of its recovery strategy is to rebuild the healthcare system that can prevent and respond to future outbreaks. For Voice of America, I'm Mvunganyi, Waterloo, Sierra Leone.